All right, so there is an etiological classification of diabetes mellitus. When you say etiology, what does etiology mean? Etiology means like the origin or the cause of diabetes mellitus. All right, so for the etiological classification of diabetes mellitus, it's quite simple. We have the type 1 diabetes mellitus. Now, this type 1 diabetes mellitus, if you are saying based on etiology, that's based on the cause, right? Its causes could be what? Autoimmune disease conditions, or idiopathic. Idiopathic, that means you don't know the cause, right? You have tried to find out, but you still can't find out what is the cause, right? Then we also have type 2 diabetes mellitus. Of course, everybody knows what type 1 diabetes mellitus is. This is when the pancreas is failing to produce insulin. While for the type 2 diabetes mellitus, there's insulin, or there's little insulin production, or there's insulin but the cells are resisting it. Okay, so other types of diabetes mellitus based on etiology are genetic defects of what? Beta cell function. You know, the beta cell is the one that will basically produce insulin. So if there's a genetic dysfunction of the beta cell, that's where you'll be having what? Diabetes mellitus. Or there could be genetic defect of insulin action. All right, genetic defect of insulin action. There could be what? Pancreatic diseases, which are affecting the way insulin is being produced. There could be endogenous insulin antagonists, or probably you just have some things in your body that are resisting insulin. Okay, there could be drug-induced diabetes mellitus. There could be genetic syndrome, right? Different things. This is just trying to look at different things that could actually cause this diabetes mellitus. Then there could be gestational diabetes mellitus, which we'll be looking at it. Okay, so this is the what? Classification of what? Etiological classification of diabetes mellitus.